Welcome back to the POPPED Podcast, where we uncover real, raw, and rarely discussed truths about pregnancy, birth, postpartum, and beyond. I'm your host, Dr. Emily Muery, prenatal and postpartum chiropractor, birth doula, and founder of Move Moms at Move Chiropractic Boulder. Today, we are diving into somebody who doesn't usually get a ton of credit during labor and birth, and that's baby. So I'm really excited to talk about baby's role in labor. A lot of times we go through, and honestly, it's because we have the perspective. We don't always have baby's full perspective of what they're going through. But a lot of times when we talk about labor and birth and all of the events that happen in and throughout, we're talking about mom's dilation and mom's contractions and mom's experience. When birth and labor is a two-way street, it is a duo, it is a partnership, it is a team effort to have mom deliver baby, and that is mom and baby working together. So we are going to start with, we're going to go through a lot. We'll go through the signals, the actual journey, what's happening, how they get out, but I want to start with the really basic cardinal movements that baby goes through in order to get out. Cardinal movements are step-by-step-ish choreography for baby to go through in order to get out. And what I'm going to go through is what's for most typical vaginal births. This is not every baby's exact choreography to come out. Every baby is unique and they have their own nuances and their own preferences, but a lot of these movements are what's happening all the way throughout baby's journey to actually come out, all the way from the start of labor to baby coming out. My sweet baby, she's not real. When she came in the mail, I just had her out on the couch at my mom's, and a couple times people passed through, they thought we just had a random baby laying on the couch. My dog thought it was a baby too. So anyway, she's super cute. She's not real, but she is going to help us through our cardinal movements. She is our little mascot at the office too. She plays with the babies while moms are getting adjusted. So for our cardinal movements, let's get into it. We have our pelvis. Remember, this is the front of your pelvis. This is the back of your pelvis. I'm not even sure that she's going to fit through this. I have not tested this out, but you'll get the gist. So we have first engagement. Baby's going to engage into your pelvis. And typically, if baby's in the most ideal, most optimal position, baby is LOA, which means the left part of the back part of their head, their occiput, is anterior. So it means the left side of the back side of their head is to the front of your body. So something like, also, if you're listening to this on Spotify or Apple Podcasts and you want to see all these movements, this would be a good episode to watch on YouTube just so you can see me working with this sweet baby. I don't have a name for her yet, so if you have a name idea. This is LOA. Baby's going to engage into your pelvis. As soon as baby passes the top brim of your pelvis, this very top aspect, baby is considered engaged into the pelvis. Obviously, they're going to work their way into the pelvis more. The descent itself, with every contraction, your baby is going to nudge their way further and further down. Then your baby is going to go into flexion. So flexion is this motion with your head, your chin coming closer to your chest. So baby's going to tuck their chin closer to their chest so that the back part of their cranium, if you think about where you put a ponytail on your head or just the smallest part, the crown of your head, it's going to be the smallest part of your head and where most of their cranial bones will overlap, which I'll come back to. So we want to make sure, baby wants to make sure that that part is aimed towards the birth canal. So baby's going to tuck their chin just like that. Oh, sorry, I'm got everything out here. Everything's moving. Baby's going to tuck their chin like this. Tuck. So this bottom part tiny part of the crown can descend into the birth canal. Then baby is going to have some internal rotation. This is different than if you are listening to this and you're like, internal rotation, you're thinking about your legs or your arms doing internal rotation. This is different. This is in relation to baby's head and shoulders. So baby's going to, ideally, again, I'm going to keep my pelvis right here and just keep baby in front of me. We'll move her arm too. There. Now you can see her well. She engages into the pelvis. She flexes her head. Then she's going to internally rotate her head. So she is going to turn her head so that it matches the pelvic opening, the outlet of your pelvic brim, which is wider, obviously, side to side. So baby's going to turn their head this way, where their shoulders typically stay in that parallel position or a little bit diagonal. After this, baby's going to extend. They start to extend. This is where they're trying to come under that pelvic brim, under the pelvic brim. Maybe if I stretch the bones. Yep. I mean, this is what happens. Your pubic symphysis literally stretches. Baby starts to extend their head. I hope you guys can see this. I'm not super sure if you can. If you can't, I will post a video on my Instagram of this actually happening in real time. Maybe not real time, but happening with a more easy way to see. Anyways, baby's going to extend that neck. So the way that I'm bringing baby's hips back, that's actually going to happen initiating from the head, where their head pulls back. Then they're going to externally rotate, which means their shoulders are now going to match where the head is. Oh my gosh, her pacifier's in the way. Obviously, she doesn't have a pacifier in the womb. Then she's going to continue into expulsion and pop all the way through. Man, she almost made it, you guys. Here we go. Here she comes. Expulsion. So the other thing I didn't really go through that happens a lot and multiple times throughout that pushing process is the extension and external rotation. A lot of times baby's going to extend out and externally rotate those shoulders and then come back in, and externally rotate out and extend those shoulders and come back in. And that's baby playing peekaboo, but really stretching those tissues so mom doesn't tear. Typically, we see this a lot more with first-time moms because the tissues need to stretch. They haven't stretched before. Baby's got to figure out how to actually fully twist those shoulders under the pelvic brim and push all the way out. She made it. If you can imagine those videos, if you've ever seen them, of like rock climbers or cave climber divers, people who go like in between really tiny spaces, and they can maneuver their way all the way through a long tunnel. That's your baby. They're maneuvering their way all the way through. They know all the nooks and crannies. They've been in there for 10 months. So they're going to work their way all the way out. Like I said before I started this, it's important to remember that not every baby is going to go through all of these exact motions in these exact ways, especially if your baby's in a funky position to start with. And when we say funky position, it doesn't mean anything's wrong with you or your baby. It just means they're in a funky position, something that's a little bit more abnormal from what we just went through. One of those funky positions that I see or hear about frequently is OP, which means baby's occiput, the back part of their head, like we talked about, is posterior. So it means the back of their head is along the back side of your spine, like this. It can be really uncomfortable on your spine, and it can be really difficult for baby's head to actually push through that thick sacrum if it's not moving out of the way for baby. Also, some babies may have limited mobility due to cord tension or any uterine tone or body positioning. So if mom's been in the same position for a long time and baby's not moving out of that station or not progressing in labor, a lot of times it's because mom needs to move so that baby can reposition it and continue nudging their way out. That's why I talk about how important it is to continue moving all the way throughout labor as frequently as you possibly can. at the very minimum every 30 minutes. Now that we've talked about the movements, let's talk about how your baby knows how to get through birth, because how do they know they're a fresh baby? How did they gain this information or this education? What's cool is that they don't need it. There's a lot of built-in reflexes within our very baby primal states so that they can maneuver their way all the way out of the birth canal. So let's talk about how their nervous system is already online and playing a huge role in that torpedo. I always say torpedo because I like to imagine them in that circular spiraling motion coming out, and sometimes babies torpedo out. Not all the time. A lot of times it's pretty slow, but anyways, babies aren't just physically moved through each contraction. They are neurologically engaged in every single contraction throughout the process. From reflexes to tone, head control, their brains and bodies know how to work together with your brain and body to get through this experience. Some of the important reflexes that are supporting birth start with really simple ones, sometimes called the fencer stance. The asymmetric tonic neck reflex is when baby's head looks one way, the arm and the leg on that same side extend, and the arm and the leg on the opposite side that they're looking from bend or flex. During labor, this can help with your baby's instinctive responses to actually turn and maneuver their way down throughout your pelvis. It's pretty crazy to think about that babies aren't just along for the ride, that they're actually engaged and working with you throughout the entire contraction process. The very first contraction, baby's engaged. They're not just like, oh my gosh, what's happening? They're not freaking out. They're not, well, I know we always have this funny, it's almost cliche now, saying like, your eviction notice is here. We are not evicting baby out. Baby is also excited to come out and meet you. So a lot of times a lot of times we think about baby, this thing happening to baby, but baby is part of this thing happening. So I really want you to think about that baby is not just on this ride with you. They're not just along for the ride. They're actually engaged. They're responding. They're adapting. They're participating in the experience with their own set of preferences, cues, clues, everything that they want to give you in order to get out. Babies also have muscle tone and head control to some degree. In the womb, they have some muscle tone. This muscle tone allows them to tuck and extend their chin throughout that laboring process. It also allows them to push off with their feet. If you've ever seen an ultrasound with a baby just like pushing off the mom's womb, wherever it is, or uterus, babies have some muscle tone. Their physics are quite different in the womb, so that little bit of muscle tone with a lack of full force gravity, with amniotic fluid helping them float, they have some muscle tone to actually help push themselves out. I've said it before, I think all the way at the first episode, that babies want to push off of your diaphragm. It's a nice soft place to push off of to help push themselves out. It's not totally uncommon to see a baby with a little bruise on their head or on their face after birth, because they're actively pressing, adapting, moving, shifting in your pelvis in order to get themselves out. And sometimes we sit in positions too long, they can't move past a small bony prominence. A bony prominence is like something sticking out like this on your sacrum. It's something sticking out. If there's anything that's just your own specific anatomy and babies maneuvering around it, it's normal for babies to have small little bruises or indents or impressions on their face just from all their work on their way out throughout your pelvis. Last I have on this section, I have two more, is cranial molding. So your baby has cranial bones. They're all separated, just like every bone in their body. They have more bones than we do as adults because they fuse together and actually become strong bones as they grow up. So babies' cranial bones are all separated. When they squeeze through that 10 centimeter dilation of your cervix, realistically, their heads aren't 10 centimeters. They're usually a lot bigger than that. So how do they fit through? Their cranium bones literally overlap each other so that they can push through. That's why we see cone head babies. And I'm putting quotation marks up if you're listening to this, because I don't want anybody to be offended. Conehead babies are normal babies. This is how we know that they got that vaginal squeeze. That cranium squeeze, that coneheadness, is such a good sign of nervous system stimulation. That baby just got such a good brain squeeze that their entire nervous system is going to wake up and now be ready for this outside world. The brain squeeze is so important. That overlapping of the bones is so important. That's why when I have C-section planned moms, or there's a chance that a C-section could come up, we always talk about, hey, you should call Dr. Emily as soon as your baby comes out via C-section so that we can do some cranial squeezes to make sure that baby gets that nervous system stimulation right from the get-go. And it's pretty cool. When our C-section babies come out, they do have pretty round heads, and it's really fun to give them just a little squeeze because they're so mobile. Obviously, we're very safe. We're trained in making sure that it's just enough pressure around baby's head. It's not too much, and it's safe so that baby can actually experience what they might have been, quote unquote, missing out on as they were exiting your body. So many moms worry that their baby's head is going to be too big, or I always hear moms come in and talk about their husband's head being so big, and they're worried that their baby's head is going to be like their husband's head. And I always have to remind them, like, your body and your baby's body has one of the coolest designs ever, and that's to actually shift and maneuver those cranial bones so that they fit through the small space that we have been allotted in our female bodies for a baby to pass through. We were designed to push babies out. We were designed to have big brain babies. We have cranial structure designed to support this vaginal birth. So if you're worried about having a big baby or a big head baby or a big brain baby, don't worry, their head's going to fit. There's very, very rare, uncommon medical needs or bony structures where baby's head will not fit out of the body, and that is when we have planned C-section. That is, again, so rare and really, really uncommon. Most females' bodies were designed to vaginally deliver a baby. Yours can too. Last thing I have on this section is coordinating with contractions. Your baby is coordinating with your contractions, even when it seems like they're not. Coordinating with your contractions means that your baby is within rhythm of your contractions. As your uterus tightens around them or downward, your baby is going to respond by adjusting their position, changing their head angle, or even pausing in between waves to rest and recover. So, these contractions, which I'm pretty sure I'm going to dive way further into in like 2 seconds about decelerations, your baby knows how these contractions are going to come within their rhythm, and they are going to use them to actually shift and work with you throughout your labor. Even when a contraction seems unsuccessful or it didn't get you any further, it's knowledge for your baby for the next contraction. Use every contraction if you need to reframe, like, why am I having so many contractions? I don't want to contract for 36 hours like I did last time, whatever it is. Your baby is using every contraction as education and knowledge of how to get out. So utilize every contraction. Give baby different options and positions. And when you can tell, and maybe you can't tell, it's okay if you can't tell, as the room around you can assess and tell that you are progressing, which will happen, you will find, okay, this position's working, baby really likes this. And it might not be the same throughout labor. There might be a long extent where baby's progressing really well in the tub. And then all of a sudden, baby doesn't progress anymore for a while. And we change to sitting on the toilet or side lying in a bed, and then baby progresses all the way. It's crazy how at different parts, at different phases of labor, baby really does want and need different positions in order to maneuver themselves out. Again, just give them that opportunity. Give them different positions, give them different opportunities to try new movements, new positions. The more you stay in movement within your body, the more your baby can find that rhythm and groove with you. Like I said, labor is a dance. Your body leads with contractions. Your baby responds with a step, a shift, a rotation. That's funny that I wrote this. We were talking about this at the office. It's so nice when you write things. It sounds amazing. And then as you're saying it, you're like, this is so goofy. But for real, this is what I wrote. Labor is like a dance. Your body leads with the contraction. Your baby responds with a step, a shift, and a rotation. It's a back and forth rhythm that requires both partners to be tuned in. Next. Okay, so we're going to do a little quick refresher on baby signals during labor. Remember, baby initiates labor. We talked about this in 2 episodes ago when we were discussing due date myths. So, anyways, if you listened to the due date myth episode a couple weeks ago, you might remember that labor is not just random when it starts. Your baby actually signals an entire cascade of reactions, events in your body to start labor. So, your baby's lungs become mature. As soon as they become mature, they start producing a substance called surfactant protein A. Surfactant protein A is released into the amniotic fluid. That triggers an inflammatory response in the uterus, which then triggers macrophages, which then releases cytokines. The cytokines stimulate the production of prostaglandins. The prostaglandins start ripening your cervix. I know that was such a long story. Thank you for following along. That is how I studied in school. So this is how we study. It's long processes. It's just walking yourself down a road. A lot of times we're like, well, I thought labor was going to start because I did this, or I thought labor was going to start because I did this. With everything that you tried, baby's going to send that first signal. Once your cervix is ripened from those prostaglandins, those contractions are going to start to be stimulated. Your baby is literally telling your body, I'm ready to come, let's do this. And then your body's like, all right, let me get ready. I got to activate some things and then we can do this. It also means that your baby has their own timeline. If you want to have a natural birth, you have to trust your baby's timeline. I know it's so much easier said than done, but you've got to trust your baby's timeline because it's their lungs. It's their lungs that tell us when they're ready. And if you didn't listen to that episode 2 weeks ago about the due date myths, please listen. I share a little bit of my own family's personal story with this exactly, not waiting until baby was ready. My brother came out and his lungs weren't ready. So go listen to it. It's a really good episode. Anyways, let's move on. Okay, what are decels? A lot of times we hear decels in hospital rooms. Your baby's heart's decels. There's decels. Baby's decelling. Baby's not I'm trying to think of all the different ways that they would say it. Baby's not tolerating this position. Baby's stressed, baby's heart rate dropped, all these things. Anyways, if you've been at birth before and you have been in a hospital, you might have heard this. And it's because it's common. It's supposed to happen. This is literally what was designed for baby's body to do so that they could maneuver through birth. So let's talk about it. What are decels? A deceleration is a temporary dip in your baby's heart rate, usually a response to a contraction. Often, this happens because of head compression. Your uterus is contracting around your baby's head. As your baby descends, it's getting smaller and smaller. So those contractions around their head are getting tighter and tighter. When this happens, that pressure is actually stimulating their vagus nerve. The vagus nerve for any human is the nerve for parasympathetic. Parasympathetic is rest and digest. When your body contracts and puts pressure on your baby's head, you are stimulating your baby to rest and be calm. So their heart rate drops. That's normal. That's normal. That's what's supposed to happen. That's just your baby adapting to the intensity of labor. It's a completely normal reflex. In most cases, we hear babies decelerating, or we get stressed, or maybe our birth providers get stressed that baby's heart is decelerating when we're monitored at hospitals. This happens when we're being monitored around the clock. Continuous monitoring picks up every single fluctuation in labor and birth. There's gonna be a lot of fluctuations in labor and birth. So when we're picking up every single one of these fluctuations, it can be difficult not to, quote unquote, overreact to these small events that we're seeing in baby's heart rate, baby's mom's blood pressure, whatever it is. Obviously, mom's blood pressure, typically that's a pretty big deal. Anyways, your baby's nervous system is responding to the intensity of labor, not necessarily throwing up a red flag or asking for help. A lot of times they're just adapting to be more tolerable of the position, the situation, the contraction, whatever it is. These small decelerations might look really scary on a printout to some people, but in reality, they're totally normal and self-resolve. Remember, your baby's working really hard, just like you are. They're just needing time to adapt to the situation. Everybody needs time to adapt, even you. There's gonna be times in your labor where you're like, I need a rest. I'm not getting rest. I'm so tired. I need to close my eyes. Baby is doing the same thing, just at a different rhythm, but that rhythm is within your rhythm, so it makes sense. When they are resting and relaxing, you are contracting. When you are resting and relaxing, a lot of times they're nudging their way down in between that next contraction. Next, your baby's position matters. We've talked about this a lot, especially with chiropractic. I just want it to be a clear picture that if your baby could crawl throughout the birth canal, they would, but they can't. And there's a lot of things in your pelvic brim and your pelvis that are keeping babies safe inside, that they have to maneuver around in order to get out. When your pelvis is not balanced through its musculature, structure, or ligaments, it's really difficult for baby to utilize the pelvis the way that they need to in order to push themselves out. Why position matters. When baby's in that LOA, like I talked about at the beginning of the episode, or OA with the just straight back to the front of the pelvis, the back of my hand is the back of their head. If they're like this, or like this, it's really easy for that head to fall past that pelvic brim. When the back of their head is against the back of or the front of your spine, it's really painful on you, and it can be a really slow progression in labor. Positioning for labor is most often dependent on all the work or work that you don't do during your pregnancy. So this is why we do the Webster technique. This is why you should be getting adjusted every single week of your pregnancy. It balances the pelvis. It reduces uterine and ligament tension. It also improves nerve communication. The Webster technique is not just a put the bones back into place technique. It really does help mom allow her pelvis to be in the best optimal function for labor and birth. If you have never gone through labor and birth before, how can you know what your pelvis needs unless you actually go to somebody who specializes in what your pelvis needs motion-wise to push a baby out? If you haven't done it before, or you're not a super expert on the pelvic inlet and outlet, I really highly encourage you to go see a prenatal chiropractor. Have someone help guide you through coming out. What is going to happen when your baby comes out of your pelvis? How is your pelvis going to change during pregnancy? I talk about this with every single one of my patients because it's so important to me that they understand what is going on in their pelvis and how baby needs to maneuver their way out. That's my mini TED Talk on my own podcast about coming to see the chiropractor. I also left a note in here. Webster is not about flipping breech babies. If you haven't listened to that first episode, go back and watch it. It's such a good one. It's my favorite one, probably because it's my first one and I felt so proud of it. But the Webster technique is not just about flipping breech babies. It's for all pregnant moms in order to keep their pelvises ready, engaged. What's the word I'm looking for? Balanced, so that they can really go through all stages of labor without pain. And I say that lightly because there is going to be some serious intensity with it that a lot of times we relate to pain, but with ease and with awareness of what's actually going on in the body. When we can be aware of what's going on, we feel so much safer. If you don't know what's going on, if you show up in a country with, you don't know the language, you don't have any money, you don't have your bag, you don't know where to go or what to do or who to talk to, how safe do you feel? Not safe at all. When you are aware of your surroundings, of your environment, of the personnel, of the relationships, of the actual events that are going on, you feel so much safer within your own body, and it can help you actually go through labor. So, fetal station is how we track baby's descent through the pelvis, through the birth canal. Fetal station measures the position of your baby's head in relation to the ischial spines, which means your sits bones. So if you reach down, you feel or palpate means to touch. If you feel or palpate your sits bones, that's where when baby's head gets to that point, it's in level with that point, that's station 0. Anything above that is going to be negative numbers. Anything below that is going to be positive numbers. So, -3 means baby is still high in the pelvis. +3 means baby is crowning. Stations are usually one of the clearest ways that birth providers use to see baby's progress. Obviously, once we've dilated, but it can be really helpful during labor to understand where baby's coming from. I've been touching my sits bone that whole time. Anyways, that was a quick little section. The last thing I have to say about this is when baby needs a little help. So there are things called dystocia. Dystocia means something that is keeping baby from coming out. Most of the times it's shoulder dystocia. Their shoulders are stuck on the pelvic brim. It's keeping them from coming out. This happens frequently. This can honestly happen really frequently if you're laboring on your back for a long time, because babies working against gravity, trying to flip their shoulders up and around can be really difficult for them. So that's why it's really important to shift and move your body. But when baby needs a little bit of help, it doesn't mean that anything's wrong with them. It usually just means that you need to change position. So you can change position. You can ask for some gentle guidance from the birth provider. If you feel like baby's in a position that they're not moving from, if you happen to have an epidural and you're like, I need to move, I need a new position, voice it. If you are worried about something like this happening, talk to your doula about it. Say, if this starts to happen, will you please voice that I need to change positions? I want to change positions. You can also adjust and complete the rotation. So a lot of times that means you fully rotating your body so that baby's weight can just shift into a different version of what it's experiencing from gravity at that moment. If you're on your back, baby's trying to come up and around, fighting gravity. If you're on all fours, baby's back, the heaviest part of their body, can just drop to the front of your body and continue coming out. Dystocia does not cancel out the baby's role in labor. They are still very much engaged. They still very much want help coming out. This does not mean that we need to pull baby out. A lot of times, instinctively, when it looks like baby's stuck because baby's head's just sitting out and contractions happening, and the shoulders aren't coming. A lot of times, instinctively, mom or birth providers more frequently pull baby out. This is really dangerous. Pulling baby out by their head and neck is extremely dangerous, yet we see it all the time. I see it all the time in birth videos. Why is pulling on the baby's neck so dangerous? Your baby's neck and their brachial plexus is extremely delicate. The brachial plexus is the nerves that come down from your neck out to your arms. They pass just under your shoulder. If you've ever seen a baby, they don't have a ton of shoulder, neck, chest space. So when we pull on the neck, you immediately pull on that bundle of nerves, which can lead to different nerve issues in the baby's arms, or nerve injuries like Erb's palsy or fractures. So most times, babies just need a change of position. If you can shift the way that you are sitting or laying, a lot of times that is going to help baby actually just get into the position that they needed to start with. I have seen multiple births where baby's starting to, or their mom and baby are starting to experience shoulder dystocia, and all it takes is lifting mom's leg, even on her back, on her side, on all fours. Lifting one leg and doing a slight rotation often shifts the pelvis just enough for those shoulders to come out. So if baby is not able to make the full flip to this horizontal, if you're not watching, go ahead and watch on YouTube right now because this will be easier to see, or Spotify. I guess you can watch on Spotify. Once baby flips, they want to flip to this horizontal position. If they can't do that and you lift up one leg and twist just a little bit, look at how much more open your hips become for baby's shoulders to pass through at that diagonal angle. Something to think about, something to practice, and something to talk to your doula about. Because it's so common, why not just talk to your doula about it? Even if you're not worried about it happening, just be like, hey, I've heard about shoulder dystocia. If you think that that's happening, or you hear someone call it out, can you remind me to lift my leg up or give a little twist or change my position just a little bit, because I think it'll help baby come out. So if you've ever thought of labor as something that you have to get through on your own, remember that you are doing this with your baby, and your baby is doing this with you. You are not alone. They are not alone. You guys are doing this together. From the very start of initiating labor to rotating through the pelvis, to responding to contractions with reflexes and movement, and nervous system regulation with that vagus nerve, down regulating their nervous system so they can relax and stay calm during a hard contraction, to adapting when things get tight and tricky. Your baby is really active. They're really wise. They're instinctual. They're moving. They want to be engaged in your labor, and they are. So let's not forget the baby is part of this. It also doesn't hurt to talk to your baby as they're coming out, because they're so active in this. Talk to them. They know your voice. They want to hear your voice. Talk to your baby as they're coming out. They're engaged. You are engaged. It helps you guys stay connected and communicative, even when it feels like you can't communicate in many ways because you're going through labor together. I did want to close this episode out with zooming in on baby's point of view, because next week's episode is going to be about from baby's point of view on the 4th trimester. So before baby gets to the 4th trimester, during labor and birth, what is baby's point of view? It's tight, it's dark, pressure builds with every wave. You feel your head press into something firm, you tuck your chin, a force nudges you downwards, and you twist your shoulders to follow. There's resistance, you pause, you wait for the next wave, then turn, then stretch, then push. It's not chaos, it's not confusion. Your baby is in their instinctive journey on their way to Earth. They are wired to complete all of this. I've said this in so many episodes. Your body, your mind, anything in your body is wired to go through birth. Your baby is wired to go through labor and birth. So welcome them. Encourage them. Don't shut them out. Don't forget about them. They are doing this just as much as you are doing this. Next week, we will continue baby's point of view in the 4th trimester, what they experience with mom. I'm so excited to talk about that and give you guys a different perspective than what we've been looking at for most of our episodes so far. If this episode gave you a new perspective on labor or just baby's role in labor, please share it with somebody. Please share it with another expecting mama, your doula, any birth provider that you feel would enjoy this episode. We want to continue to grow and strengthen our birth community. So the more that we can share and encourage others with these episodes, the stronger it gets. You guys are awesome. Thanks so much for listening. I've had a blast. I didn't tell you. Go like, subscribe, leave a comment, leave a review, whatever feels good to you. I'm Dr. Emily, and you've been listening to the POPPED Podcast.